In the name of God, most merciful, most compassionate, good afternoon. Your Excellency, the Prime Minister, Your Excellencies, the ministers, the dignitaries, ladies and gentlemen, I would like to welcome you to this meeting in which we announce the matrix of COVID-19 recovery stages. The matrix represents a procedural document that defines the stages of reopening and closing industries, activities and facilities, and the measures of travel, movement and traffic, and the methods of their management. These are matters of substantial impact on the lives of citizens and residents. The announcement of this document and sharing it with the public is a commitment the government has taken upon itself with a view to being transparent, and it is also sharing it in order to provide clear standards so the state institutions and the community are capable of responding to the pandemic and take the efforts to recover. The crisis of COVID-19 has been a challenge for the whole countries of the world, and Jordan was not an exclusion. It is a multifolded crisis that requires interdisciplinary solutions and responses that require coordination between and among multiple state institutions. The Jordanian model, based on the Jordanian model of managing and responding to the crisis upon the instructions of His Majesty the King, ensured that responses were proactive, expedient, and well coordinated among all state departments. And this has set an exemplary model commended by many. We in the government cooperated and worked with the armed forces and all other state security agencies, and with the National Council for Security and Crisis Management, and with the leadership. These efforts and endeavors were led by the Prime Minister and closely followed up by His Majesty the King. The roles were harmoniously and clearly distributed, the thing that resulted into this achievement. We thank everybody for the great efforts exerted. We thank the leader of the crisis cell, the workers therein, and we also thank the soldiers who've been working behind the scenes at the different state institutions as well. We also highly commend the role of the National Council for Security and Crisis Management, and we extend our thanks and appreciation to His Royal Highness the Director, the Deputy, and to the Deputy Director and the staff who've been working very hard. Our meeting today with the state institutions representatives and the representatives of the civil society organization is an example of our participatory integrated approach that we've been following upon dealing with this crisis. And this very approach is the thing that we're going to pursue as we manage the process of reopening industries and activities with the sense of joint responsibility and collaboration. This unprecedented experience has proven to us that the precondition for success is the commitment of every individual at their own position. I'd like to give the floor to the Prime Minister, who's going to tell us about the vision on which this matrix is based and its role in helping us achieving the level of recovering from the repercussions of the pandemic, be it economic or health related. In the name of God, most merciful, most compassionate, good afternoon, everybody. And our news for today are very positive and very good. We are in fact going to announce the plan of reopening industries, and we're going to report the fact that we have achieved a very good level when it comes to the implementation of this plan. I'm talking about us being at a medium threat level. We'll explain this later. What's been achieved is thanks to the efforts of everybody, the wise leadership of His Majesty the King, the participatory approach where everybody cooperated. The citizens who've been cooperative and compliant, they complied with the difficult measures despite everything. And this is something that we give you the credit of. Now, we give you the credit for this. Now, this stage that is beginning here, and we're going to address the details of this stage. My colleagues, the ministers, this stage will lead to reopening of industries and will lead to allowing travel and movement inside the governorates and between them over the coming few days. Today as well marks the end of the isolation period that was imposed on a number of infection hotspots in Mafraq, Irbid, and Jarash. And also today, over 2 weeks, in fact, by the way, over 2 weeks, we've been registering less than 10 cases of COVID-19 cases whose source of infection is local. What has helped us achieve this, in fact, is the approach we have followed upon working together and our commitment. And if you allow me here, I would like to talk about the approach that we have followed. And I'm going to give a very brief description for the matrix, and my colleagues are going to talk about the details furthermore. And we're going to see, then we're going to talk about our position from the health and economic perspective, and then future tendencies. And I would like to start saying from the very beginning of our response, the instructions of His Majesty were clear that the utmost priority should be given to the health of citizens. At the same time, however, this should be also parallel to our endeavor in reopening industries, be it economic or social, in a manner that does not compromise the health of citizens. From the very beginning, and we were among the first countries that formed a health task force. The epidemiology committee was a very important element in it, and the economic team, which studies the priorities of industries to be opened or reopened and deciding this from the perspective of their impact on the macroeconomy and employment. And the third task force was the social protection task force, because we realized that this is going to have an impact on the lives and livelihoods of citizens. This task force cooperated and collaborated on daily basis with the different state departments and security departments, because whenever we plan for a decision, we need to understand beforehand and in advance if there are consequences that we haven't accounted for, or if this decision can be implemented expediently. And by the way, this center, the National Center for Crisis Management, was the place where we met again and again, and the crisis cell in particular, which included the institutions and the main ministries studying the recommendation, the proposed recommendations and the repercussions and consequences thereof until the decisions in their regard were taken. This is an approach that is relatively new to us. In fact, we've seen that it is a very resilient, effective approach that can be updated as we go and as we work. There are studies, in fact, which maintain that the resilience of institutions is managed and is measured against how effective and how flexible can they be upon working with others. And I thank Dr. Abdullah from the Crisis Management Center, who has given us the literature on these indicators, where we have been studying it together in depth in order to learn from it, and in order for this to inspire us as we work and as we pursue our responses. Now, what is the matrix and what are the alert levels on which it is based? From the very beginning, we committed ourselves to being fully transparent with you when it comes to the numbers and the figures and the epidemiological situation. And now we're taking another step ahead as well. And we are also committing ourselves to being fully transparent when it comes to the threat levels and the standards that we follow in order to measure our position when it comes to these threat levels. I mean, when we measure where we are from these threat levels: a critical threat level, high threat level, a significant threat level, medium threat level, and low threat level. These 5 threat levels did not come from vacuum. In fact, these are the fruits of the experience that we have gone through together. Also, it is inspired from the experiences of other countries. And I would like to thank the team who has worked on developing this. So I really thank this team who has worked on developing this matrix, which gives clear information for the private sector, the government, the citizens. It gives them all information that they need upon learning that we're moving from one threat level to the other. I mean, when we say that we are at this threat level, what does that imply on the industrial level? Which will be open, which will be reopened, which will be closed, what it means on the movement level, what the implication of that when it comes to travel, and so on. So we have 5 levels of threat: critical threat level, high threat level, significant threat level, medium threat level, which is the blue coded threat level on which we're at which we are now, at which we're on now. And then lastly, the low level threat. And now the fact that we are at this blue coded alert level means that the vast majority of industries and activities are open and movement is free. And the efforts and the collaboration of everybody will help us arrive at the low threat level. However, we need to understand that the health situation and the epidemiological indicators may require that we regress back to the blue coded alert code. However, hopefully not to the orange or the yellow coded alert codes. In the light of these efforts, in the light of these results, where are we now from an economic perspective and from a health perspective? Now, to start with, if we compare ourselves to other countries from a health perspective, I do not think that anybody would disagree that Jordan has excelled on the regional level and also on the international level. We in fact are among the 4 or 5 countries that are most commended for their response to the pandemic. I am talking about our response to the pandemic from a health perspective, the number of cases, the number of deaths, and so on. This has been achieved thanks to the fact that we have taken strict measures in the beginning to protect the health of citizens. Now, what about the economic perspective? In fact, now the international studies have shown that countries that started their response early, they benefited from this they are benefiting from this now because they are ready to reopen their industries at the time that the world is reopening its economy. Countries which did not have paid dear for this. It paid it on the health level, too many cases that overwhelmed the health system. At the same time, the economy and their industries are closed because of the health situation, while the world economy and the industries in the world are reopening. So they cannot catch up. Now, this situation that is commendable, I mean, the situation we're at that is commendable is, this situation helps us to recover promptly. However, we have to realize that this pandemic has caused a shrinkage in the world economy and has not spared us at all. Now, when we closed movement and when we closed industries and blocked movement, that was at the same time and simultaneously the economy in the world was closed. I mean, tourism in the world was closed. Also, international trade was halted. Every country wanted to maintain and preserve their stocks of all commodities. Therefore, and at the time when our businesses and economy was halted, the economy of the whole world was too. So now is the time to recover and to catch up expediently. Looking at the countries around us, we see high prevalence of the pandemic, while they try to reopen their industries. However, they're still overwhelmed with the health situation. Being overwhelmed with the health situation impedes that process, I mean. Now, what about the future now? What the actions that we're going to do to take are? First, our approach, our approach. In fact, our approach has been very effective. In the past, previously, I mean, we used to work independently, each in their own sector and in their own position, without realizing that whatever they do reflects on other sectors and levels. Now, this has become a belief, a conviction that we believe, that we have realized. Everything you do has impact horizontally and vertically. What the government does on the vertical level impacts the other agencies downstream, the governor, the municipalities, and so on. So this participatory approach needs to be maintained as we pursue our efforts and endeavor. This matrix reflects this participatory approach, and the document will be made available to everybody. The second criterion in relation to health is about having strict compliance with health and preventive measures. In the early stages of the response, it was relatively easier because we just say it's a lockdown, you stay at home, industries are closed, and so on. But now, now that industries are open, it is the responsibility of citizens to ensure that health requirements and health measures are observed. There will be close oversight and inspection. There will be inspection teams throughout the governorates in order to ensure that enterprises, workers, and customers, all citizens, are complying with the health and safety measures. So we talked about approach, about health, and now the third is economy. Upon the instructions of His Majesty the King, we started the National Council, the Advisory Council for Economic Policies, and now we're in constant dialogue, and we are setting the policies of industries. We understand, everybody realizes that the shock of the pandemic and the impact of the pandemic was not the same for all industries. Some have been severely damaged because of this, including tourism and road transport, while other industries have in fact benefited, rather thrived in this condition. So our response to these industries should be proportionate and should be in line with the impact the pandemic has had on them. We're in daily contact with the damaged industries. We know their challenges. The biggest challenge they had was their current costs and expenses. We help them reduce them. However, when it comes to employment, our main focus was to eliminate the dismissal of employees. Our main concern has been the risk of arbitrary dismissal and laying off of employees, because this does not only negatively impact the employees or enterprises, rather it impacts the whole economy. We said at least we need to find a solution that could be temporal, but allow us evade two bad options: allowing the enterprise to collapse or allowing it to dismiss its employees. We say it will be acceptable for the enterprise to reduce the salaries for a couple of months until it revives. Then this is better than the other two options. This requires everybody enjoying a spirit of social responsibility, the thing that we will also need as we recover. We also realize that our workers, especially in the private sector, are going to be negatively impacted, are going to face the financial repercussions, and therefore we activated and introduced our programs with new mechanisms, Tadamun and Musanid, the social protection programs. And we also have the National Aid Fund, Himmat Watan Fund. Looking and considering the numbers from the beginning of the pandemic till the date, we have 100,000 Jordanian workers who benefited from Tadamun, 120,000 who benefited from Musanid, and 200,000 who benefited from the National Aid Fund and Himmat Watan Fund, and 78,000 benefited from the central bank program, which was mainly in order to pay the salaries of workers. We're talking about 498,000 Jordanian workers in these enterprises, in these industries, which means 2.5 million families. The thing that means that we help them at least for now through this crisis. This is not the end of it. We will still need the support of everybody in the private sector, in the public sector, until we fully recover with the minimal impact on the life and the employment of citizens. Now, while we had industries that were negatively impacted, others have thrived and others have performed very well. Not only can they adapt, in fact, they can benefit from this opportunity. For example, our agricultural sector. We would like to salute every Jordanian farmer who has been productive during this difficult period. In fact, our production in the first and the second quarters of the year increased, and our exportation to neighboring country also increased. Also in relation to other sectors and industries, medical supply, pharmaceuticals, also our production increased. More than 100 production lines were introduced and were started during this pandemic in order to produce the supplies needed for the pandemic, and we started exportation in addition to our medical industry, physicians, pharmacists, nurses, everybody did their job very well, and this tells us that these industries, manufacturing, agricultural, food processing, pharmaceuticals, medical supplies, and services that can be remotely delivered, all of these are industries that we can count on and that are promising. We're going to depend on them significantly as we recover, and we're going to emulate their example in all other industries, including tourism. Now we're going to focus more on medical treatment tourism with my colleagues, the Minister of Interior, the Minister of Tourism, the Minister of Health. All of them know that we receive many demands and requests from our Arab brothers who come to Jordan seeking medical treatment, and we are working on a plan that will be finalized soon to promote medical tourism in Jordan. And last but not the least, Jordanians, with their heads held up high, and with their pride, and with their limitless potentials, have translated the slogan that we have, "Man is Jordan's greatest asset." We have translated that in practice, and Jordanians are entitled to being proud of their leadership, of their achievement, and of what they're going to achieve upon dealing with this pandemic. Peace be upon you. In the name of God, most merciful, most compassionate, good afternoon, everybody. Right from the very beginning of the pandemic, ever since we started to deal with the repercussions of this pandemic, we were looking for a model that sets an internationally approved model that sets the measures to take upon deciding which industries to close, which to open, the time frames for such closures, and so on. That was new, unprecedented to us. Therefore, it was necessary for us to take these decisions as we work and as we act in an intensified manner in order and in a manner that is mainly governed by the health concern to protect the health of citizens. And there has been great collaboration in the process of taking decision. In fact, there has been an ad hoc ministerial committee, business continuity committee that regularly met and that consulted regularly with the Ministry of Health, the National Epidemiology Committee, and also collaborates on daily basis with the crisis cell and with the National Center for Crisis Management to develop all the decisions that are being taken, to develop the recommendation, the decisions that are being taken based on the recommendations. So we graduated from a process of complete closure, gradual reopening. Upon deciding, upon making any decision, the main concern was health. And there have been a set of concerns and standards on which we base our decision. The health concern is the highest priority of these concerns. The basic needs of citizens was as well, because we need to continue the delivery of basic services, water, electricity, internet, continue the delivery of food supply or maintain the food supply. And we gradually went through this process, reopening industries gradually, like I said. And thank God, when you compare us to other countries in the world and maybe countries in the region, I would say that we have succeeded in the different areas I talked about, whether when it comes to maintaining a good health situation, maintaining the delivery of basic services, including water, electricity, and so on, maintaining the food supply, while in the biggest economies we've seen shops and stores with empty shelves. This has not been seen in Jordan, and that is thanks to the cooperation of the private sector as well. During this period, we documented the actions we've taken. We've documented them promptly as we take them. And we put them together in a matrix. The measures that we've taken, we put them together in a matrix. And we studied this matrix at the Supply Chain Committee, Supply Chain and Business Continuity Committee. We thoroughly studied it, added to it, submitted to the Ministers' Council. The Ministers' Council studied this matrix, studied also the National Council for Crisis Management. Dr. Abdullah exerted a great effort examining it in depth, and also the crisis management cell considered it thoroughly. Mazen Bek and the colleagues, everybody contributed to the improvement of this matrix the way we see it today. We have learned a lot from this experience, and in fact the matrix that we have in hand today needs to be and will be updated and reviewed regularly. The best thing about this matrix is that it enables us all, be it citizens, private sector, government, to be on the same page. And it helps us predict what's going to happen now in terms of industries to be reopened, industries to be closed, and that will be determined by the health standard. Like I said, it is the basic thing for all of the matrix, the health standard and health concern. During this pandemic, much has happened to us. The thing that enabled us to come this far, thank God. There was a continued dialogue with the private sector, which enabled us to continue to deliver the services, to pursue the manufacturing mentioned by the Prime Minister, the agricultural sector, the trade, and everything. In the beginning of the pandemic, we only produced 30,000 masks, but now we produce more than 1.5 million masks, which covers our needs and also enable us to export. This matrix has 5 gradual levels of threat, starting from the critical threat level down, and the last is the low threat level. And therefore, health standards are gradual on this hierarchy, and the implications that follow to that in terms of the industries to be reopened or closed, or the movement. So, like I said, the thing that the concerns that govern this is the health of citizens, the continuity of service delivery for basic needs, and the possibility for the said industry to spread the infection. So this matrix has 5 gradual alert codes, starting from the alert code of critical threat level down to low threat level. Therefore, what follows to this alert code, the health standard, this alert code is based on health standard, and what follows to that is industries opening and closure. In the development of this matrix, we based it on the health standards, the basic needs of citizens, and stability of economy, maintaining the economy by way of reopening industries, especially industries that do not contribute to the spread of the infection. This matrix covers the vast majority of economic industries, but it is, like I said, a flexible document that we will continue to update. Thank you very much. Good afternoon. Since the very first day, of our battle against the COVID-19 pandemic, the instructions of His Majesty the King and the priorities of the government was to safeguard the health and lives of citizens, and also to strike a balance between safeguarding health on one hand and the needs of the economy and the society on the other. Our conviction has always been that in order for the country to recover, we need to maintain and safeguard the health of citizens. And this has been our approach. The approach we followed upon dealing with this matrix in terms of, for every stage, we decided first what the threat level of this stage is, and that will be determined by the epidemiological situation, which is represented by the number of cases, their sources, and the scale of tests. And therefore, the health risk indicators is the thing that defines our readiness as a society to pursue more reopening, and it also determines when the reopening will take place. As for the health threat indicators, they're based on the following: the number of detected cases in 7 days in a row, except for the first stage, the ratio of detected cases out of the scale of tests conducted. This is an international standard. What is more important than the tests you conduct is the number of the tests that is the number of cases that test positive out of the number of tests that the tests you conducted. How many tested positive? And we are also going to increase the number of tests, and therefore these are the standards that we have adopted. Moreover, in this pandemic, we pursued and shall also continue building the capacity and improving the capacity of the medical sector, including the production of medical supplies, and also our health capacity in terms of, at the Ministry of Health, in terms of building new ICU intensive care units. 2 intensive care units were built and they're ready. Now we are building an intensive care hospital, and the Royal Medical Services finalized the delivery of the oncology department for it to be used by the for emergency, and the Minister of Health delivered the emergency Bashir Hospital. It was delivered during the pandemic. It can accommodate 60 intensive care with the patient with the ventilators. While we were supposed to receive the hospital in July, we received it now. So that was a great effort conducted in order to deal with this pandemic. The matter of travel from and into the kingdom this was a question we were asked. The fact that we are at this blue alert code requires that we deal with countries of also a blue alert code. No country accepts working with countries at higher threat levels. It's either country that is at my threat level. We have simplified measures as we work with one another. But for people coming from countries with a high level of prevalence, this requires that we have further measures in order to receive passengers from these countries. As you can see, and we are at the medium threat level state, because the number of cases resulting from sources, local sources, were less than 10 over 7 days in a row, or the percentage or the ratio of positive cases is less than 0.5% to 1%. The cases that test positive or out of the total number of tests conducted. Yesterday we had 5,800 tests. Out of them, only 3 tested positive, but they were coming up from abroad. So if we're going, 2 only tested positive, and they were coming from abroad. This is to say that this is not from a local source. It is less than 0.2 which means that we indeed are at this level, this threat level, the blue alert code. This is the methodology we adopt, and you can see on the matrix when our health situation is this, what the threat level is, and therefore what are the implications in terms of industries to open. Again, I'd like to welcome you in the light of the announcement by the Prime Minister in relation to implementing the COVID-19 recovery matrix, and based on the fact that less than 10 cases have been registered on a daily basis for 7 successive days. As of Saturday, June the 6th, 2020, Jordan shall start the medium threat level stage, the thing that requires that, in addition to what has been announced earlier, this will lead to the reopening of industries and facilities, mainly mosques and churches, before worshippers, for them to perform all prayers, while adhering to preventive and safety measures and physical distancing that will be defined by the Ministry of Awqaf, the Ministry of Health, and the Church President Council. Nurseries also, while adhering to the safety and preventive measures. Cafes and restaurants also as per adhering to preventive measures. Gyms, restaurants, and hospitality, which hospitality sectors including hostels. In domestic air flights is open now at this level of medium threat level. We're going to continue to close a number of industries, being schools and nurseries, universities and colleges, training institutes, cultural institutes, wedding ballrooms, funeral receptions, youth activities, including scout camps and any other youth activity, the nature of which requires physical presence and gathering, cinema, event and conference management enterprises, parks and entertainment cities and play areas. As for the curfew, it's going to be reduced to become the following. As such, there will not be comprehensive lockdown days. The movement will be possible from 6 a.m. to 12 a.m. for citizens, and the enterprises can start work from 6 a.m. to 11 p.m. As for the dawn prayers at mosques, which is going to be during the curfew hours, worshippers are allowed to walk to mosques. And as for movement, it's going to using private vehicles is open now, and we repeal the use of odd-even scheme. Public transportation vehicles can travel through governorates with 50% passenger capacity. And at this level, we're going to open visitations for prisons and care houses. However, citizens above the age of 70 are not allowed to move, and we're going to stop all the activities of weddings, funeral receptions. So these are the activities that we have reopened, and we have halted a limited number of them. And these are also the details related to curfew in this blue alert code, which shall start on Saturday. Like we said, these are procedures that are constantly, closely, promptly reviewed and are associated with the epidemiological situation, and therefore they are subject to change as prescribed in the matrix. The fact that we are at this situation in terms of the epidemiology and health allows us to resume our social life, and therefore we need to maintain these gains and to capitalize on them and to promote them in order for us to arrive at a level of low threat, which will help us go back to normalcy. And we hope that the worst is just behind us and the high threat levels are just stages in the past that we will not go back to. This, however, is all dependent on the level of awareness and the level of adherence to preventive measures and adherence to physical distancing. And it is our responsibility to pursue and progress and to improve this further. Jordan shall also prove to be an example to be followed when it comes to recovery, not only an example to be commended when it comes to response. Thank you very much. We're going to open the floor for questions for the audience from media agencies and from representatives by the civil society organizations and think tanks. I would like to invite the Prime Minister and the ministers to come to the stage in order to take the questions of the participants. We will take 4 questions only, please. Good afternoon, and we're happy that we are at this threat level. Could you introduce yourself and make sure that you speak closely to the mic? Makram Tarawne, I'm Al-Ghad newspaper editor-in-chief. Thank God we have arrived at this level, and we hope that soon we will get even to the low threat level stage. My question is, now that we are at this good situation, epidemiological situation, and now that we are going back to normal life, is there still a need for the defense law, or is it enough for us to have the state legislation, especially that there are some flaws related to some defense orders, particularly Defense Order number 6 and the amendments thereof? Mr. Prime Minister, the matrix is purely procedural, which is very necessary in order for us to move from shutdown to operation. Reopening industries is very necessary. However, in fact, a number of committees were formed in cooperation between the ministry, between the government and the private sector. My question is, what are the findings of these committees, and how are they going to reflect on the different industries, be it pharmaceutical, food processing, and so on? What the impact of the results of these committees going to be? My question to the Minister of Health is, we are at the Blue Alert Code. You're saying that we are going to be able to work with countries at the Blue Alert Code. Are we sure about the soundness of their procedures? Are the indicators, are their procedures based on quantitative indicators? Thank you very much. أعتذر عن ترحيل السؤال باللغة الإنجليزية، ولكن هناك جمهور دولي يرغب في الاستماع إلى تجربة الأردن. سأطرح سؤالي باللغة الإنجليزية. أنت عالم اقتصاد، والأردن لم تكن في وضع اقتصادي جيد قبل. Good afternoon, Mustafa Rialat, the Dusturi Editor-in-Chief. I'd like to congratulate you for these great results. Thanks to the efforts of everybody, the state institutions at all levels indeed. Now that we are at this level of stability in the epidemiology, and according to the matrix, the majority of industries are to be reopened. This is a good positive thing. The question is, how can the state oversee this vast number, huge number of industries and enterprises, And how can you monitor the extent to which they comply with the preventive and safety measures in order to include that there won't be any relapse? Peace be upon you. Adnan Badarin, the director, the editor-in-chief of Al-Haqiqa Al-Dawliya. Does the government have a plan, an economic plan to deal with the situation after Corona, in the aftermath of COVID-19? Ahmed Awad from the Phoenix Study Center. I would like to extend my thanks and appreciation that were for the efforts exerted in the health aspect. This is an achievement. This is a rich experience, actually, that made great achievements. Most Jordanians are proud of this experience. I have one topic to focus on, which is the social protection system in Jordan. Over the past 3 months, we've seen that there are holes and gaps in the social protection system. Half of the employees are not covered by any social protection system, the thing that made the situation hard for the government and made the lives of the citizens hard. What is the government plan in order to ensure that all workers in Jordan are going to be covered with the social protection, and in the plan to ensure that all the internationally approved benefits are applied in Jordan and made available to all workers? I'm the director of Al Jazeera Network in Jordan, Mr. Shobaki. Commenting on the latest circular under Defense Order number 6, actually, there's a lot of criticism against this circular Defense Order number 6, and many say that the government has put the employees under the mercy of employers and also the public sector. There are the reduction, the bonus allowances are deducted from the civil servants' salaries. The question is the government going to review these measures, because they were supposed to be temporal, provisional measures taken in order to address the situation? Or are you going to take a very long time to amend the actions that are supposed to be interim that have been taken? And also the Defense Order number 6, I would like to comment on Defense Order, the circular under Defense Order number 6. I would like also to mention that there is a discrepancy between the figures mentioned by the Minister of Labor and the studies, labor-related studies, which indicate that the number of persons dismissed from their jobs is more than 2,300, while the Minister of Labor say it is 2,300. Thank you very much, the Fourth Authority. I'm very happy to see you again. It's been a while since we meet you because of this pandemic. I'm going to answer some questions and my colleagues will comment on the details of the other. The Defense Order, Mr. Makram. We as a government look forward to the day when we say this is the last defense order. Now we have a green alert code, and that's it. That's it. We dealt with all of the repercussions, the health repercussions, the economic repercussions, and things are going back to normal. Indeed, we really hope that this will be the case very soon. And I'm sure that all of us, the Jordanians, we're of course very proud of the national legislation, the constitutional institution that segregate powers and so on. But to tell you the truth, Mr. Makram, the most important decision we've taken with the blessings of His Majesty the King was to activate the defense law, because had it not been for this law, what did this law help us do is the following. Everybody is now talking about the controversial measure we've taken, but in fact, every measure we've taken, we were able to implement and expediently act and respond, dealing with the pandemic, its repercussions, and so on, and enforce the decisions related to movement and traffic and travel and so on. Had it not been for this decision, for this defense law, things would have taken much longer. We're not claiming that the defense order were perfect or were great and they were flawless, of course not. But we had to take these orders and we had to take these decisions, and we were saying, well, now as we move forward, we can review things promptly. Now, even the instructions of His Majesty the King as to activating the defense law, his focus was protecting private properties and the public freedoms and human rights. So the practice, the enforcement of the law was at the narrowest level that is only related to COVID-19 and its direct and indirect repercussions. Defense Order number 6, I'll come back to talk about it in a while. Now, Mr. Fayeg, you talked about the matrix, and it's a procedural matrix, important for everybody to know where they are and what applies to them and what does not. However, many people do not know the following. What's behind this procedural matrix? There is an analytical system that we have thoroughly worked on, in which we considered international experiences and our own experience. Dr. Abdullah and colleagues at the crisis cell, Mazen Bek, and all of the brothers, they all worked on this matrix. There is a logic behind these figures, a logic that determines how we analyze them and we work on them. As for the private sector, the Minister of Industry and Trade can talk about the details of this. However, we have taken some measures that help the private sector temporarily in relation to reducing costs and so on, but at the same time we are working with the private sector on the process or for the stage of adaptation and recovery, and for some benefiting from this experience. We're at an advanced stage in our dialogue with a number of sector, including tourism, road transport, and so on. And we shall announce these soon, especially when it comes to the groups, touristic groups and delegations coming from abroad, and the process of dealing with them. And we are seeing initiatives from countries that are at the same threat level as ours. We are seeing how they control and how they coordinate such activities. فيما يتعلق بسؤالك حول الأثر الاقتصادي للكورونا، أنت محقة، الأثر حاد جدا في الحقيقة، ولقد شعرته كل واحدة من الدول في العالم بغض النظر عن حجم اقتصادها كبيرا كان أم صغير، والأردن لم تكن استثناء على ذلك. كما تفضل وزير المالية أيضا أن البنك الدولي والصندوق النقد الدولي وضعوا تقديرات للانكماش. لقد كنا من قبل نعمل في 2019 كنا نعمل على زيادة النمو، الأرقام 1.9 أو 2% من النمو كانت محبطة بالنسبة لنا. أردنا أن نرفع نسبة النمو وصولا إلى 3% ونزيل المعيقات التي تحول دون ذلك، لكن للأسف الآن التقديرات تتحدث عن انكماش بنسبة 3%. العالم الآن يتجه بمنحى آخر وبما في ذلك الأردن. التحدي أمامنا هو نوع الحوار الذي نجريه الآن، والحوار الصريح والتفسير الواضح. هذه هي الأرقام، هذه هي الوقائع، هذه هي الفجوات التي نعاني منها. هذا ما سوف نقوم به، وهذه هي الخيارات المتاحة أمامنا. تماما كما نحن شفافون فيما يتعلق بكل الأرقام التي أدلينا بها ذات الصلة بمرض كورونا، سوف نكون أيضا شفافين وواضحين فيما يتعلق بالتداعيات الاقتصادية والخيارات الصعبة التي علينا أن نأخذها، وأيضا فيما يتعلق بالمطار وما يتعلق ب فتح الحدود. أعتقد أن زملائي الوزراء يستطيعون أن يذكروا أشياء إضافية. شكرا. سيد مصطفى، مستر مصطفى. Oversight, we were talking about this in fact, and we have a mechanism going to ask the Minister of Industry and Trade to tell us about. He didn't mention it in his brief. It's a very important mechanism to have unified inspection. We do not want every enterprise to be inspected by multiple inspectors, some coming from the municipality, some coming from the Social Security Corporation, and so on. This will be confusing. We want to have unified inspection who would come, check compliance with all standards and measures, and take measures against people, against enterprises that violate these standards. And I'll be honest, we're going to be very strict when it comes to this, because it is the life of our citizens that is at stake, and also what's at stake is to regress at the matrix and at the threat level stages. This is something we don't accept. Nobody will be able to go around this, and nobody will be able to violate these measures. And if somebody does so, then they are doing harm to themselves and to the country. So yes, do expect thorough, strict inspection and oversight, and the law will be, and there will be strict enforcement to the provisions of the law. Now, we are working on parts of the recovery stage. We're done with the adaptation stage now that we have this matrix. The last and final stage is recovery and economic resilience. Now, we are amending what was developed in 2019 in terms of our annual plan towards focusing on main industries, 3 main industries that are being followed by His Majesty the King on daily basis, because he finds them, he realizes their importance, agricultural production and agricultural processing. It's a great opportunity for the Jordanian economy, especially when we move to, when we have 100% Jordanian labor force. The added value of this sector is very enormous, and therefore we need to utilize it in order to increase exportation and in order to employ locals. The matter of employment and unemployment, as mentioned by Ahmed Bek, is going to be a challenge, and I shall move to talk about employment and the social protection for social protection system, and I'm going to talk about Defense Order number 6 and the circular there under. This pandemic will definitely impact the number of employees and the number of the unemployed. The question is not, are we going to be immune to the impacts of the pandemic? The question is how to mitigate its impact on employees and how to shorten the period of the impact. The countries of the world had similar experiences. Germany during the international economic crisis, and now when a company gets insolvent because of the conditions, it is helped by all parties, the government, the employees, and the state. We say, okay, even if it's part-time job, even if it's working from home, even if we reduce the salary by 20, 30, maybe 50% if it is a severely damaged industry, only temporarily until things go back to normal and people go to their job. What is really dangerous, we should have explained this in the beginning, in fact, the danger is to allow for thousands of people to be dismissed of their job. Do we know, and do we actually know what the accurate number of people who were laid off? Well, the Ministry of Labor announced if you were arbitrarily dismissed and laid off, if you were laid off not according to the provisions of the law, you file a complaint with the Ministry of Labor. And this is the number that the Ministry of Labor is sharing, the number of people who filed complaints with it. But we do not claim that they are the only employees whose services were terminated. We want to know, because it is our responsibility to protect them. And we can negotiate on transitional measures that help everybody recover. In the defense order, we talked about a month and two. It was March and April, and now we're talking about May and June. So we're talking about short, limited periods. At the same time, the social protection is being offered. Now we're working with the Ministry of Labor, with the Social Security Corporation to expand the social protection base. I will link this to something very important. The most important sector that we need to cover its employees with the social protection is the agricultural sector. We can't be say that the best people to promote agriculture is the locals of the country, while we don't cover them with the social protection and the benefits other people get. There are farms now in Jordan Valley and in Mafraq. The workers thereon are Jordanians, and their production is something to take pride of, and therefore we need to give them their rights and to expect high productivity in order for us to be able to expect high productivity of them. Also, the small enterprises, some of them are not organized, they're not in the formal sector. Even if it is a small shop, they are obligated to register with the Social Security Corporation. We want them to do so in order to provide protection for the employees. If they don't, they're not going to benefit from the protections of the Social Security Corporation. They might go otherwise to the National Aid Fund. It's okay, but it's not the optimal option though. As for the defense order number 6, the impressions, the feedback on this, in fact, is something that we very much understand. You might recall that defense order number 6 was something that employers protested against, because it was mainly about controlling dismissal. When we saw that the pandemic lingered, and there have been industries like restaurants and hotels, those service-oriented industries, they had two choices. The best is bad. They will either close down the enterprise altogether, or will have to dismiss some of their employees. This is what we wanted to do, to communicate with everybody in order to find this compromise, to introduce this compromise. Sometimes we take decisions where we try to strike the balance, and of course there will be one party that is happy, another that is not. But in all cases, these are interim procedures that will only be temporary, and this is until we get back to normal. And thank you very much. Thank you, Mr. Mustafa, for your question about inspection. And in fact, this question is something we had on mind for a month. When we started reopening industries, we set the procedures and the measures that we follow in order to ensure adherence with the preventive measures. And we wanted to oversee the implementation of preventive measures. There is no single ministry that can do all of the inspection required. You need a huge number of them. And in my opinion, among the things that we learned from COVID-19 experience is that there are systems that work in an excellent manner, but they work independently. So what we did is that we brought together inspectors from all ministries, and their number was 2,300, more than 2,300. Therefore, we developed a system of inspection, the unified inspection system. The Ministry of Labor inspect labor-related matters. The same for FDA, the same for the Ministry of Industry and Trade. But now for this period, we define the things that everybody is going to inspect, and also in order to be able to control them. In the municipalities, they were under the control of the municipality, and in the governorates under the control of the administrative governor, and in cooperation with the Minister of Interior. The number of inspections that we have conducted till yesterday, in the last month and a half, 80,000 enterprises in 1 month and a half. 1 month and a half. If you heard this 2 months ago, that would be not possible. But now that we brought together all inspectors from all departments, organized their work with a mechanism, a multidisciplinary mechanism with clear procedures that will enable us to cover more enterprises and inspect them. And of course, that is in cooperation with the PSD and the different security departments. As mentioned by the Prime Minister, we're going to work harder, we're going to activate, and we're going to intensify the work, because we learned from the experiences we've had. There will be enterprises that adhere with the preventive measures and others who will not. And we will close and suspend enterprises in order to maintain and safeguard the health of citizens. Thank you. I forgot your question. So we're at the blue alert code. Does this mean that we're only going to work with countries that are also blue alert code? Now we define what are the countries that at our threat level. But this doesn't mean that if somebody is red alert code does not come to us. But if they come from a red alert code, will be dealt with as per protocols. Inspect, test at the airport, quarantine 14 days, test upon release, house quarantine. But if it's a yellow alert code, there will be respective protocols to follow. We put the health standards, but there are security standards, but there are aviation standards. There are standards related to facilitating the flow of persons. Everybody set the standards related to their respective specialty, and then the crisis cell decides the protocol in order to ensure this, that the process is seamless and smooth. The devil is in the details. Now, as for countries that are at the blue alert code, we will test them. We will test them upon arrival. If they test negative, that's it. Because they have 5 cases every day in a population that is 10 million. Of course, there will never be zero risk, but I don't know when things will end, but I hope that will be soon. I just want to remind you that the document of the matrix is posted on corona.moh.gov.jo. This is at the website of the Ministry of Health. Thank you very much.